We see that the addiction as a disease by using medical imaging methods. In the beginning, we used that instrument called positron emission tomography that would allow us to see brain chemistry. For example, we label with this short half-life isotope with medication that being used for imaging of the dopamine receptors, especially dopamine D2, D3 receptors. And we use that to see how the brain chemistry change. And also we use that sugar, we call radioactive sugar, to see the brain metabolic change. And so those are the imaging tools we use in the beginning. And later on, we also use that functional MRI to see the brain functional change, and that also see the connectivity in the brain and see if there is any brain connectivity changes, one area to the other one of the area, whether they have any changes in the brain or not. So those are the tools we use to see the brain as addiction is a brain disease. The brain changes after they use the drugs, such as cocaine, methamphetamine abuse, alcohol, heroin. They all have changes in the brain dopamine D2 receptors. As we study that of cocaine abuser and methamphetamine, we found that these changes, it takes a long while to recover. However, that lately we found that drug users such as methamphetamine abuser, we found that actually, in fact, the people, they have the minor changes. After a year of follow-up, their brain haven't recovered yet. But this interesting is this group of the people, they have the less brain dopamine changes. They remain in the recovery and they remain abstinence. But we found a group of the patients, initially they have the worse off in the brain dopamine functions and receptor changes. They relapse. The changes all depends on the condition at the time, how much they use the drug and how much they affect their brain dopamine system. As a scientist, that we find that addiction is a disease. And we see that the addicts, that they are a group of persons. They've been suffer from a long term of the drug use and abuse. We see them are very, very similar as the person with hypertension or diabetes. As a physician, I know that once you have the disease, usually it takes a while to treat. You might recover, you might need a long-term treatment for using a drug or using some other things. But since it's a brain, you can use either a drug or you can use either behavior or other means to help them to recover, and then maybe into that a cure situation. But it's a chronic disease. The difference of the cocaine abuse and the methamphetamine use is very different from a person, they go to church or they're having sex. Dopamine system affected by the drug such as cocaine and the methamphetamine, they have a very severe impact. Usually dopamine system is a system related to our habit formation. And that if you go to the church or you're doing the sex, usually that is considered normal, and that within the system that we can absorb because that's normal. But the cocaine and methamphetamine, once the people use it, this is a system, it forms a very tight bond of the habit. And this habit is not a normal habit. This is an extreme form of the habit. And that is considered addiction. And that the brain in the dopamine system, they sometimes take a while to recover with this severe form of abnormalities. And that is the problem. There are different degrees of the brain changes affected by the drug. Okay, some of the drug they have the worst of, but also depends how much you use that drug. Okay, a lot of drug abusers initially they smoke cigarette, and then they pick up the drug. Depends on availability. For example, that the drugs such as methamphetamine is much more prevalent in that West Coast. It's beginning from Hawaii and then in California, and then right now merged into that Mideast, in the Midwest and the mainland of that United States, and rarely in the East Coast. Right. But however, in the West Coast, in the past was cocaine, but now the people may use the drug, such as heroin and others, such as marijuana. As we in the past many years, we found that several of the drugs, such as methamphetamine, that is a very, very strong impact to the brain, and the person take a while to recover. But different drugs have their different problems, and that people say, well, alcohol is kind of benign, but alcohol also would destroy a person's life. And that heroin, once the people take it, and then they have physical reactions, as such that they depend on the heroin, and once they don't use it, they have cold turkey, and it's very, very difficult to get out. And cocaine, they have all different problems. They might cause the stroke inside the brain and many, many things. You say that, well, cigarette smoking is no big deal, but you got cancer. Right? So each drug have their own different degree of the differences, and then that in the past that people use only one because that's their preference. But right now they mix all these drugs, become a cocktail. Then it's difficult to tell what's what. But the problem is still the cause, their addiction. They cannot get out of that. That's the problem. So that once the people into the drug use abuse, and then they'll change that the brain limbic system, and also affect that the frontal cortex. And usually these two systems they link together. Then if the adolescent they use the drug, and that the brain is developing, especially in the frontal cortex. And frontal cortex is the area they develop after the people were born, and then that area mature around age of 25. So during that maturing age, that if the person they start using the drug, then they lost the control, because that frontal cortex actually, in fact, is area related to our control. And people always say that our parents actually is the frontal cortex of the children. Once the children they take the drug, then the area of the frontal cortex, their development change, because that would inhibit or causing the damage to the frontal cortex. So the frontal cortex relate to our memory, executive memory, and a lot of them relate to our planning of our life. And once these important function lost, then it has a strong impact to the life in the future. The person, they cannot plan their life better. They cannot have a good memory about whatever they learned. That has a strong impact. During that detoxification, that your natural desire will come out. And so this is that, because this is part of our life, now you start to have a deep to understand your inside. Because that our body connect, the brain and body connect. So you start to aware of whatever happened inside your body. And so instead of the artificial stimulation from outside, you start to understand your inside. And this is that as a normal person, this has happened to you all the time. But since your brain already hijacked it by this outside abnormal force, and then you all pay attention to the outside force. Now you don't have this outside force to influence you. Then you take more consideration of your internal signal. And then you start to have this signal you ignore for so many years come out. So it's not unusual. This is happening. And now you just have chance to understand. That's all. So you have to get familiar with this signal and how to deal with that. We like food. We're thinking about food. That is normal. Because we need to eat food for survival. However, if you are craving signal so strong as such that lead you to eat those food is not appropriate to you, then those people will gain weight a lot. Then will lead to obesity in some people. Eating the right appropriate food to you is very important because craving is part of our life. So marijuana, actually they do affect the brain. It's subtle way. And the marijuana gradually would affect a person's judgment. And it would be difficult for a person, especially they are handling the instrument. For example, if the person they're driving the car, or the person they're driving the airplane, or they are doing something that need a very good coordinating skills and all those kind of very focused actions, then they might have problems. And they might need to fatal action. And the long-term use also would affect gradually a person, their life going to be destroyed because they will lose their motivation. They don't want to do things. Initially, it looks good and interesting, but eventually the brain will change. And then also their body response to a lot of stimulation also change. Not only in the brain, also physically. Their heart and their blood vessel response to the stimulation also change. It's that kind of change in part very similar to cocaine or other drug abuse. Alcohol is also very different. Is alcohol, they change, especially the brain string a lot. And because that they affect a lot into the structure also inside our brain. And physically also affect our body. For example, that the liver also have a great impact. And then the person, they have strong to destroy their life by the brain just cannot function properly. Especially like frontal cortex is so worse that the people, they just cannot organize their life. And so that is very different. So each this kind of drug they destroy the life in a different aspect. but if that person in the job situation, they have a very strong different impact. But basically, they all lost their judgment, and then they lost their control of their life. Pain medications that a lot of them, they contain opiate. Some people, they use it because of the consequence of surgery or consequence of injury. They get the medications, and then they like it because that can help them to release their pain. But in the situation that the people, some group of the people, they are particularly vulnerable to this kind of medication. They feel high from the medication and they want to use it. And then it becomes a chronic use, that it is beyond the normal to relieve the pain. And that is considered, they call chronic pain. And so this is that under this situation that they need medical help. So once the person, they take the pain medication, and then they feel good about it. And then gradually they just depend on it. And then become chronic pain situation. So that they need medical attention. They need the physician to help them to get out. Parkinson's disease patients, they use that some of the medication, then they make them become sex addicts or even gambler. As a normal person, usually this medication is not the same. As a normal person, that is different story. And number one, you don't take these kind of medications. And also our brain in the balanced situation. Parkinson's disease patient, because they have problem in their brain neurons, and they cannot produce enough dopamine. So the other side of the receptor, they also downregulated. So once they take medication to increase their dopamine, then because of deficiency of the dopamine receptor, make them very similar to the drug user. And so it's different, yeah. Right now, that proton emission tomography and functional MRI is being used as a research tool. It's very, very different from use in clinically for the cancer, because this is functional changes. And until it is a very, very dramatic change inside the brain, and sometimes it's difficult to use that as tool, as diagnosis tool. And so that we may use that for some particular purpose to see whether they have a structural change. But how to use that as evaluation of the functional change at this point of time still need further research.